Good afternoon. It's time. Um, this is technically our last talk for the pain session, but the talk from the second week that was canceled is rescheduled for next Thursday, same time. So even though we don't have other ILR classes next week, we will have the one on pain, and I've heard she's a great speaker. Even Stephen here told me she's a great speaker, so do come. Put it on your calendars. So today's speaker is Pratscher. Stephen Pratscher. He is an research assistant professor in the Pain Research and Intervention Center, the PRICE that we've been talking about at UF. He's originally from Chicago, and he got his he did his undergrad work in Chicago and then moved to the University of Missouri, where he got his PhD in psychology. His subjects were more like his interests were in interventions in health, well-being, things like meditation, breathing, etc. Then he came to UF as a postdoc with Roger Fillingham, who's the co-facilitator of this course and is also the first speaker, if you will recall. So Stephen did a postdoc with him, and then after that, he became an independent researcher with his own grant. Currently, he has his own grant to do independent work. His interest is focused on developing and testing integrative interventions as possible treatments for chronic pain. I would call that as alternative approaches to treating pain rather than medications. He's broadly interested in mind-body interventions, especially types of breathing, and determining whether they are effective treatments for different types of chronic pain. And if you'll recall, last week, somebody had asked the speaker about this, about meditation and breathing affecting pain. So here we have an expert. And I might add, we are lucky to have him because he's got a job offer from Ohio State and is moving next month. So we are fortunate to have him here today. Please welcome Stephen Pratscher.
Thank you, Pushpa, for that very kind introduction. And thank you all for being here and being open to this sort of type of talk on integrative interventions for chronic pain. So my grant from the NIH is to develop and test a type of breathing or breathwork intervention. So there will be a major kind of focus of breathing on the second half of my talk. But first, I kind of want to just review a little bit about chronic pain and some of the ways that myself and some other pain researchers kind of think about it, and also go a little bit into complementary, alternative, integrative, and sort of the differences between those words and approaches. We get a click. There we go. So some of the work I'll talk about has been supported by grants, but I don't have any relevant financial relationships to disclose. So as you've probably heard by now from this part of the series, chronic pain is a major public health problem. It's extremely prevalent and one of the most common reasons that people seek medical care. It affects 1.5 billion people globally, or about 1 in 5 adults worldwide. And as you can see from the graphs, the prevalence of chronic pain continues to rise with age. And so for adults 65 and older, the prevalence is at least 36%, but I'm sure many of you here have experienced different types of chronic pain, whether it comes and goes. And so you kind of are familiar with the experience. And high impact chronic pain is considered pain that is more than sort of moderate and influences people's daily lives. And so although the numbers look kind of low, it still has a very broad impact on both physical and psychological functioning. It's one of the leading causes of disability, and it interferes with people's ability to engage in daily activities and to even enjoy a normal life. It has many negative impacts on stress, sleep, mood, and interpersonal relationships. And then in the US, we spend up to $650 billion per year in direct medical costs and worker compensation. So really, I say this just to highlight that chronic pain is extremely prevalent and the personal and economic burden is massive. So chronic pain is most often examined through something called the biopsychosocial lens. So we know that in order to understand the pain experience, we need to consider multiple interacting biological, psychological, and social factors. So again, things like stress, negative emotions, catastrophizing, and fear and avoidance can all make pain worse. And chronic pain is a condition itself, even though it's often a symptom of other diseases. And so it's most often defined as pain on most days for at least the past 3 months. And that means it's lasted longer than the expected period time of healing. And it's quite common for chronic pain to lack a clear underlying or identifiable cause for the pain. So, for example, with chronic low back pain, especially, there's a very weak relationship between radiographic imaging, things you might see on an X ray or an MRI or a CT scan, and a person's subjective pain experience. And so there's been multiple studies where you can compare two side by side X rays where it looks like there's huge degeneration at a disc and a perfectly healthy spine, except the person who's in an 8 out of 10 pain is the person with the healthy spine, and the person who is not in pain is the one with the degenerate discs. And so it just goes to show that there's a lot of interacting factors that come into play when you're experiencing pain. And while pain is ultimately interpreted in the brain, the pain experience is influenced by both bottom-up sensory information coming from the periphery, as well as top-down modulation of these signals from the brain and the central nervous system. So as you can see, chronic pain is this complex and multifaceted condition, which may partly explain why pain tends to persist for years, and it's often very difficult to treat. And so that brings us to a major issue for both pain research and clinical practice. There's a urgent need for safe, effective, and accessible treatments. Most common chronic pain treatments are only modestly effective at improving pain and or reducing pain and improving function and quality of life. And so biomedical treatments, for example, things like pain medications and steroid injections, they target primarily sort of biological and physiological contributors to pain. They're more of like a unimodal treatment, but then they also have higher costs and risks associated with them. So things like opioid use disorder or failed back surgery. And so they have risks kind of inherently built in, even though they can be helpful potentially in the short term or for some people, and they are necessary at times. And then psychosocial or behavioral interventions, on the other hand, things like cognitive behavioral therapy or other sorts of psychotherapies or exercise, they're relatively safe and inexpensive, but they too also only have small effects for improving pain, mood, and sort of overall quality of life. And so that's why I think developing integrative interventions that target both the top-down pain processes as well as the bottom-up pain processes might be especially relevant for reducing chronic pain and holistically improving a person's life. So that brings us to complementary and integrative interventions or approaches. Because pain is so complex, it's highly unlikely that we're ever going to find a simple pill that cures everyone's pain. Chronic pain is more than just the biological factors of nociception if you sort of were to burn your hand and then experience pain. It has a lot of overlapping effects in the brain that's tied up with emotions and other things too. So there is this strong need for sort of complementary and integrative approaches. And so first I want to go through some of these definitions of what I mean by complementary and integrative. So complementary is defined as a non-mainstream approach that's used together with conventional medicine. And so that could include things like getting acupuncture along with medication. Whereas alternative is more often viewed as a non-mainstream approach used in place of conventional medicine. And so that could be just going primarily to like a traditional Chinese medicine doctor and not receiving more Western medical care. Or there's other systems of healing where people may only seek out alternative medicine. Whereas nowadays, I'd say it's much more common for people who do use non-mainstream approaches, which we'll get into in a minute, also use conventional healthcare. And that kind of brings us to integrative health or integrative medicine, because it's about integrating different sort of styles of approaching health and well-being. And it brings together teams of doctors or interventions that integrate multiple sorts of components. So yoga, for example, it integrates the physical practice of yoga is about the postures, the asanas, the movements that occur, but it also involves coordinating movement with breathing. And it also involves meditation, where at the end you stay silent and still and sort of get into more of a meditative state. And so that's considered a multi-component intervention. It's more than just receiving a pill or getting a procedure. And so here are some types of complementary and integrative interventions. Actually, I want to back up for 1 second and real quick highlight nccih.nih.gov. So this is the branch of the National Institute of Health, NIH, which funds my work. And it used to be called NCAM, the National Center for Complementary and Alternative Medicine. But there's been a much bigger push now to get away from this idea as these types of medicine as something alternative, because really what we're finding is that they can still be useful alongside conventional care. And so the highlight is we can integrate these sort of models of medicine together, because they might be helpful to improve other sorts of symptoms that you might not be able to address with certain types of biomedical care or treatments. Okay, so what I often think about with complementary and integrative interventions are mind and body practices. And so that's kind of on the right side of this screen. And so this includes things like meditation, yoga, Tai Chi, but there's also things like music and dance and art therapies that people can engage in. There's also acupuncture and manual therapies, things like massage and chiropractic care. And then there's a whole host of nutritional approaches or natural products that are studied. So that can include things like probiotics. It can also include vitamins, things like vitamin D. Here in Florida, we are lucky to have a lot of sunshine, and that can influence our health and well-being. Also looking at melatonin, but basically there are all different sorts of vitamins and sort of supplements that can be studied for their impact on health and well-being. And then there's also medicinal plants that some people study, and whether it's the actual medicinal plant or looking at the sort of makeup of the plants to try to make medicines from. And there's also diet and dietary patterns. So something that some of us are interested in here at University of Florida and more broadly are intermittent fasting. So not necessarily changing how you eat, but changing the pattern of how you eat. So if you were to eat for an 8-hour window and fast for 16 hours is one typical sort of style of intermittent fasting. But there's lots of variations on this sort of idea of time-restricted eating. One thing I do want to point out is food as medicine. So there's this concept that actually has good research that our diet and the things that we eat can influence our immune system, and especially levels of inflammation. And so maybe you even notice that yourself, based on certain foods that you eat can make your body react in different ways. And that can influence your pain level. It could influence your sleep, but it can also influence just how you generally feel. So I think this just kind of gives you a broad overview of what falls under the umbrella of complementary and integrative interventions. So within the realm of complementary and integrative medicine, there's a push towards more focus on what's often called whole person health. The idea is that we treat the entire person and we don't just focus on symptoms of a disease. It sort of forces us to push or pushes us to think about health and the body more holistically. So it's not just that we're separate organ systems, but if you're experiencing stress, that can have a direct effect on your heart, that can affect your gut, your digestion, indigestion. It can cause tension and tension headaches. It can cause pain in other ways too. And so the idea is that we're not just separate systems working independently, but we're a whole sort of body and a whole sort of system that incorporates the mind as well as the body, and in some cases, even our sort of spirituality as well. And all these things don't have to be sort of treated independently of each other. So you don't have to go to a doctor just for one separate organ system. It's about trying to coordinate care in a way that sees someone holistically as a whole person, to try to improve overall health and well-being. And it also includes more positive aspects of functioning. So if you look at the top, there's sort of these bidirectional arrows of healthy and disease state. And so an interesting thing about this model is that you can intervene at different levels to try to move along this continuum of a health state or a disease state. So it's not that in some cases that you necessarily can't get better or can't move to a healthier state through things like self-care or exercise or nutritional sort of approaches. And then one thing I wanted to highlight is a more recent measure that was developed to try to measure this construct of whole person health. And it's now going to be implemented into these large national surveys. And so I'll kind of go through the items. And if you want, you can kind of rate yourself on a scale of 1 to 5 in your head, just to get an idea. And these are kind of rated as excellent, very good, good, fair, or poor. So how would you say your health in general is? How would you rate your quality of life, focusing on what matters to you? How would you rate your social and family connections? In general, how healthy is your overall diet? How would you rate your physical activity compared with other people in your age group? How would you rate your ability to manage stress? How would you rate your sleep? How would you rate your ability to find meaning and purpose in your daily life? And how would you rate your ability to manage your health, focusing on aspects of health that matter most to you? So just a couple things to think about with this is, one, it's a very broad measure. It captures a lot of different domains of health and well-being and functioning. But two, one thing that's kind of unique about this compared to other measures of health is that it includes more of a spiritual domain, things that you find purpose in doing, ways that you find meaning, what matters to you. That's not often front and center in certain models of health and well-being. And I think it can play a big role in the ability to get through different things and have more zest in life and sort of ability to enjoy and even persist in the face of any pain or other sort of symptoms. Okay, so how common are these types of complementary and integrative approaches? We can look at the prevalence and trends in usage from large longitudinal studies. And so this is a more recent one looking at over the span of 20 years, going from 2002 to 2022. It's not shown on the graph, but these types of complementary and integrative health approaches increased from 19.2% in 2002 all the way up to 36.7% in 2022 for pain management alone. So in that 20-year span, the usage among people experiencing pain nearly doubled. So it'll be interesting to see if this trend kind of continues or where it kind of levels off as time goes on. And some of the largest increases that we're seeing were in yoga, meditation, and massage therapy. Although what's not represented here, and what I find the most interesting and sort of promising integrative intervention, has to do with breathing. So here's a quote from Andrew Weil. He's a medical doctor who founded integrative medicine. And this quote kind of ties together some of the reasons why I find breathing so fascinating and really have kind of made it my primary area of study. So he said that breathing is unique as the only function that can be fully voluntary or fully involuntary. As such, it's a bridge between the conscious and the unconscious minds as well as between mind and body. Proper breathing nourishes the central nervous system, establishes a harmonious pattern for other bodily rhythms, and also regulates moods and emotions. So breathing is a vital behavior that sustains brain and body function. It's a health behavior like the big three of sleep, diet, and exercise, but it often receives far less attention than those three, even though it's absolutely essential for our survival. So you can only go a few minutes without oxygen as compared to days without sleep and weeks without food. And because breathing is so fundamental, the respiratory system is intricately connected to the brain, as well as, which I want to mention again, is where pain signals are ultimately processed. But it's also interconnected to other systems in the body, including the cardiovascular system, the lymphatic system, the musculoskeletal system, the nervous system, and more. And so we also know that breathing is bidirectionally associated with pain, stress, and emotions, such that how we breathe influences how we feel, and how we feel influences how we breathe. And so one of the sort of reasons I think conscious breathing is so promising is because we're leveraging this multi-dimensional system, this brain, mind, body behavior that might be able to influence the complex and multi-dimensional pain experience. So what is breathwork? It's an umbrella term, means different things to different people. But at the broadest level, breathwork can simply mean breath awareness. So noticing how you breathe and where you breathe. Are you breathing in your upper chest? Is it fast or slow? Easy or labored? There are a lot of different qualities that you can notice with awareness. And that's why some people consider meditating on the breath as a form of breathwork. But more concretely, breathwork is the conscious, voluntary, or volitional control of breathing that's often used for different purposes, such as to improve health and well-being or even to improve athletic performance. Interestingly, breathwork can also be considered as a form of neuromodulation. It's a way for us to change nervous system functioning, including how we process stress. So, for example, we can consciously control our breathing to influence activity in the parasympathetic and sympathetic nervous system, which plays a role in our ability to work directly with the stress response and the relaxation response. And of course, there are many, many different types and techniques of controlled breathing. And I wanted to make this presentation a little interactive. So we're going to go through a few together now if you're interested and would like to join along. So again, this is completely optional, but if you'd like to engage, feel free to join in. And we'll start by just sitting up straight, getting into a comfortable position. If you want to uncross your legs, that can be nice. If you're comfortable, you can allow your eyes to close and just begin by noticing your breath. Where do you feel the breath flowing in your body? Is it the strongest at the tip of your nose? Do you feel it coming in and out of your chest? In and out of your belly? Just taking a few moments to be aware of your breathing. And now we'll see if we can notice one full breath in and out without getting lost or distracted in thought. So feel the breath coming into your nose, moving down the back of your throat, belly expanding, chest expanding on an inhale. And then follow that in reverse all the way back out. Belly and chest falling on the exhale, and the breath moving back out through the nose or mouth. See if you can do that again. One full breath in and out without getting distracted. And then slowly coming back to the room, opening your eyes whenever you're comfortable. So that was just a little taste of mindful breathing. We didn't necessarily control the breath, but you might have noticed that as you place your attention on your breathing, it tends to slow down naturally. Really, the idea with a mindfulness practice is as soon as you notice your mind sort of wandering or drifting away, thinking about something else, you simply bring it back. And that's kind of the repeated practice of mindfulness meditation. As your thoughts drift away, you just catch yourself and you bring it back. And you bring yourself back non-judgmentally without sort of evaluating yourself as good or bad or judging yourself as I'm doing this wrong. You just simply keep bringing the breath back. And the thing is, the breath is often used as an anchor in this type of mindfulness meditation because it's always in the present moment. Your breath is always flowing in the here and now, in and out. But again, breath work more concretely is the sort of conscious or volitional control of your breathing in different ways. And so I'll have us go through a few breathing practices together. Again, this is voluntary, so feel free to join if you'd like. But also know that you can always stop and return to normal breathing at any time. Don't feel like you need to strain too hard, or if it's uncomfortable, just return to normal breathing. So we'll go through a few of the common practices together. And these ones have varying levels of research behind them, but they're often sort of offered as sort of breathing practices. And so the first one is called box breathing. It's actually been used by Navy SEALs because it's a way for us to try to regulate stress. Navy SEALs are in kind of extreme stress situations, but it's a way to sort of be able to calm down how we're feeling and develop more resilience in the face of stress. So for these practices, you can keep your eyes open because the screen will kind of guide us through the breathing. And for this box breathing, it's called box breathing because it involves equal counts of 4-second inhale, 4-second hold, 4-second exhale, and 4-second hold. And if that feels too long or too challenging, feel free to modify it in whatever way that is comfortable for you. So it could be 2 seconds, 2 seconds, 2 seconds, or 3 seconds, whatever feels comfortable. For this, I'd recommend breathing in and out of your nose if it's comfortable, but if you're stuffed up, feel free to breathe in and out of your mouth. And if you feel uncomfortable or lightheaded, again, just return to normal breathing or shorten duration. So you can follow the on-screen timer. We'll start with an exhale here. Then you hold it. And then you take a breath in. Hold. And exhale. And we'll just do a few rounds of this. Hold. Inhale. Hold. And exhale. Hold. We'll do one last round. Inhaling. Hold. Exhale. Hold. So the next one is called 4-7-8 breathing, and it's another one of these down-regulating breathing practices that's meant to calm us. So typically when the exhale is longer than the inhale, that's when we engage more of our parasympathetic nervous system, our rest and digest, rather than the fight or flight aspect of our nervous system. So it's supposed to be more calming and relaxing. So again, you can see it's already started, but you inhale for 4 seconds, hold for 7, and exhale for 8 seconds. We'll wait for it to kind of come to the top. And again, if it's too challenging, it can take time to work up to these numbers. But if you'd like, you can breathe in, hold, and then a long, slow exhale out. A little longer than usual breath in, hold, and another long, slow exhale out. Okay. So this last one we'll do is called coherent breathing. And so it's also called resonant breathing. It comes in different names, but basically it involves equal counts of inhaling and exhaling with no holds at all in this one. The image will guide us, but again, do what feels comfortable for you without sort of overstraining. And remember, you can always choose to return to normal breathing at any time. So we'll start again with an inhale. And exhale. Another breath in. And out. Do one last one in. And out. Oh, yes. Yeah. Mm-hmm. Yeah. Yeah. Well, that's a good point. And that's actually part of my response is, so the question is, why would you hold your breath? Because that can also cause stress and increase sort of sympathetic activity rather than calm or relax us with some of the purpose of these techniques. Short answer, these breathing techniques have been sort of practiced and tested and are a potential way to improve stress resilience. So with the longer exhale, part of what is improving our capacity to sit with increased CO2 levels. And so it's about increasing CO2 tolerance, for example. And so it can feel stressful at the start, kind of like at the start of doing physical exercise or movement, like lifting weights, for example. It can be challenging, but the idea is it sort of improves over time. So you have more ability to do it comfortably and you build up that sort of baseline level to tolerate different levels of breathing and sort of capacity to alter your breathing in different ways. I know that's not the perfect answer that you might be looking for because it does vary. And for some people, it can cause more stress than relaxation. And so, like everything, it's kind of try it out and see if it's something that works for you or it might not be. Like that's why there's varying practices that people can engage in because they're not for everyone necessarily. And to be honest, so my favorite of those is the coherent breathing where it doesn't involve any breath holds. and that's actually similar to the research that I'm about to talk about, which is called heart rate variability biofeedback. And I know I want to spend most of my time on pain, but this is really new and exciting research coming out about breathwork and Alzheimer's disease. And so I just wanted to spend one slide talking about it because this research came out on, again, it's a similar breathing practice than we just did, and its effects on amyloid beta, which is a biomarker central to Alzheimer's disease and neurodegeneration. So the heart rate variability biofeedback, you can kind of see in the picture below. It's a individualized a bit more to each person to try to maximize their heart rate oscillations. And so some people might be instructed to inhale and exhale for 5 seconds, while another person might be instructed to inhale to 6 seconds. And part of that is because people are different heights. And so one of the nice things about this app is it kind of gives you a real-time display of your heart rate variability, which is a sort of indicator of parasympathetic nervous system activity and also used as a biomarker in other ways. But what's interesting about this study is it sort of maximized people's heart rate variability by giving them certain breathing instructions. And then they tried to minimize it in the control condition. So they would measure what their optimal breathing rate was, but then had them breathe in a different sort of frequency to compare it to. So they receive a lot of the same instructions, but then they try to isolate what they're trying to study. And so for this one, they instructed people to practice this for 20 to 40 minutes daily for 4 weeks. So ideally 20 minutes in the morning, 20 minutes in the evening. Not everyone engaged in it to that degree. And it was a relatively large sample of young and older adults. And one of the reasons that I wanted to highlight this is because the heart rate variability biofeedback condition, which maximized these sort of oscillations, found reduced levels of amyloid beta in the blood of both younger and older adults. And it's especially interesting because it was the first behavioral intervention shown to reduce levels of amyloid beta when not even exercise had been shown to do that at that point. And then in a similar study by the same group of researchers, they investigated whether a mindfulness meditation with slow breathing versus normal breathing also reduced levels of amyloid beta. In this one, it was different because it was a shorter practice. It was only for 1 week, but still 20 to 40 minutes. And the major limitation of this study, it was on younger adults of an average age about 26, so not nearly as generalizable. But they did find significant reductions in amyloid beta in the slow breathing group compared to the normal breathing group. And so one of the reasons I highlight it is because it suggests that it's not just a factor of being mindful or meditating, but it's actual physiological effects associated with the slow breathing that might influence other sort of physiological variables, including like brain clearance and other sort of ways that biomarkers are expressed in the blood. So to get back to pain, the most recent meta-analysis on breathing practices and breathing interventions were on chronic spinal pain, which can include neck pain and back pain. And they actually found small effects, clinically insignificant effects for improvements in pain and disability. This was over 20 studies that included about 800 participants. And the authors kind of broke it down into 2 categories: slow, deep breathing, which can include some of the practices that we engaged in, or something called respiratory muscle training. And so to give you an idea, this is a device you can actually buy on Amazon for $5 to $8, and it's a way to try to improve lung function. But the idea related to pain is it's kind of like a workout for your respiratory muscles, especially the diaphragm, because it adds resistance to inhaling and exhaling. It makes it a little more difficult to breathe in and breathe out. And the idea with the diaphragm is it has not only respiratory functions, what keeps kind of us breathing in and out, but it also has postural functions. And so the hypothesis is that improving diaphragm function by sort of using this resistive breathing device, kind of like lifting weights again, can improve our postural control, which thereby improves neck and back pain. So that's the idea, but only small sort of clinically insignificant effects were found for these across all these studies, which, I mean, had limitations in them and lots of variability. But again, the reason I bring this up is because I think that there are other types of breathwork interventions which have much more sort of potent effects, which is really where I'm focusing my research. And so that brings us to really, this is what I'm funded to study, and this is what I'm most interested in studying. It's called integrative breathwork interventions. It also can be called therapeutic breathwork interventions. It has plenty of different names. Basically, these types of breathwork interventions have been around since about the 1970s. And there are all these different schools or brands of breathwork, which basically use the same sort of breathing technique, conscious connected breathing, as their core component, but then they differ with respect to their theoretical framework, as well as other components that they include in the breathing intervention. So this conscious connected breathing technique, which we won't do, but it involves no pause between inhale and exhale. So it's also known as circular breathing or continuous breathing or connected breathing. But basically the inhale is encouraged to be deep, full, and active, and then the exhale is encouraged to be relaxed, just kind of letting it go like a sigh. The breathing is generally done in and out of the mouth, a little bit deeper than usual, and often while a person is lying down. In these more activating types of breathwork sessions, they're either guided by a trained facilitator in one-on-one sessions, or they're offered in a group setting, kind of by Again, a trained facilitator, maybe in the community or at a yoga studio. And so breathing in this way for extended periods of time can alter consciousness, and it leads to a wide variety of different types of experiences: somatic, sensory, affective, cognitive, and even spiritual experiences for some people. One of the most interesting things about this type of breathwork is that it's not uncommon for suppressed emotions, feelings, memories, both positive and negative, to come into consciousness for integration or resolution during a session. And even though it's been a popular intervention in the real world for the past 50 years or so, there's been very little rigorous research on this type of breathwork. And so that's where I have this 5-year grant from NIH to develop and test this type of integrative breathwork intervention to see if it is a safe and effective treatment for people with chronic pain. And so we're focused on a specific type of breathwork called guided respiration mindfulness therapy. It's a mouthful, so GRMT for short. And it's a highly experiential therapy with 3 core components. The first is respiratory regulation, which includes the conscious connected breathing technique that I just explained. Again, breathing in this way for extended periods of time tends to alter consciousness. It's almost like a radio dial. As you breathe deeper, that it turns up the dial on sensations or emotions or feelings in the body, so to speak. The second component is mindfulness of somatic sensations while breathing. And so a primary instruction while you're maintaining the breathing pattern is to pay attention to the strongest sensation moment to moment, and include an orientation of acceptance. So rather than pushing away whatever you're feeling or resisting what you're feeling, the idea is to just be present with whatever sensation is alive in your body at that moment. And this sort of somatic tracking can develop interoception and mindful body awareness, which have both been shown to increase pain processing and emotion regulation. And then the last component is relaxation of physical tension. So it involves identifying and releasing any areas of tightness, tension, or holding in the body, and also to relaxing resistance to feeling sensations in your body, which could be uncomfortable and painful or associated with fear and avoidance. So for the study, we're testing an 8-week version of the intervention delivered one-on-one with a trained facilitator or therapist. It's a single-arm trial as part of intervention development, but then we are moving to a randomized controlled trial as we finish up phase 1 and move to phase 2 of the study. We're looking first at people in chronic low back pain, but then we have another study, which I'll describe in a second, in broader chronic musculoskeletal pain. And the thing is, with the 8-week version of the intervention, the actual content of the sessions don't vary from week to week, but the experiences that occur can be vastly different within people over time as they go through it or across different people. Again, there's a lot of different things that can come up. So in a different study, we looked at just a single session rather than the 8-week session, and this was in a group format rather than a one-on-one format. And the rationale for doing more of a single session group intervention is because just like you can drop in for a yoga class or a meditation class, it's something that's sort of ecologically valid or that represents something that could happen in the real world. And so for this, it was a smaller study just as we're launching this type of research, but it was 11 participants with various types of musculoskeletal pain. And as you can see, the intervention was rated as highly acceptable and satisfying with mean ratings of about a 9 out of 10. And then we also found clinically significant reductions in both pain intensity and pain interference, with baseline levels of pain starting at about a 6 out of 10 and dropping to about a 3 out of 10 after just a single 60-minute session that were sustained at the 2-week and 6-week follow-ups. And then there were also larger effect sizes in things like secondary outcomes like sleep and pain catastrophizing. And so I'm currently conducting a follow-up study with internal seed fund grant to test it in a slightly larger sample with a randomized controlled trial design using a wait list. And that kind of brings me to future directions. So we're still in the very early stages of developing and testing this style of integrative breathwork interventions for chronic pain. We're moving through a very common framework for developing behavioral interventions or mind and body interventions. And so it kind of starts with smaller uncontrolled trials and then moving to pilot trials. And then eventually our next step will be to apply for larger funding where we can actually do efficacy studies where we'll be able to make claims one way or another, whether it actually is an effective treatment or isn't an effective treatment for certain people with different types of chronic pain. I'm hoping to do this in both the group version of the study as well as one-on-one version, and in different types of chronic pain and in general, potentially other sort of indications too, because it's been studied for people with anxiety and depression as well, but never within the context of chronic pain. As you can see though, there are lots of steps to go through before it might become something that is disseminable or implemented into a healthcare system. You might have heard of the statistic that it takes 17 years to go from research to clinical practice. And so we're trying to be very strategic about it and kind of advance this wisely so that if it is something that's helpful or effective, that people can actually access it if they would like to try it. But again, there's still so much more that we need to learn about this type of work. And so to wrap up, I just want to, again, highlight that integrative interventions are things that can be incorporated or integrated into sort of what you're already doing or along with the care that you might already be receiving. For chronic pain, as well as overall health and well-being, there are several self-management or lifestyle interventions that you might consider engaging in that could be potentially helpful. And that can include things like exercise and movement. There was some research showing that even walking can help prevent low back pain in the future. And then, of course, there's diet, nutrition, and sleep, which again have all been shown to reduce inflammation, which can be helpful in different ways as well. And it might improve not just pain, but also overall health and well-being. Then there's many types of mindfulness and meditation that you could explore if that's something that you're interested in. It doesn't have to be formal sitting meditation where you just stay still and sit and focus on your breathing. There are lots of different kinds of meditations, including something called loving kindness meditation or mantra meditation, which involves repeating phrases in your mind. But then you can also sit in a more comfortable chair, or you could lie down, or you could be mindful while you walk or while you eat. There are different ways that you could try to incorporate it in your life if that were something you're interested in. And then breathwork. Again, breathing has this bi-directional relationship between pain, stress, and emotions. So it's one of the quickest and easiest things we can do to try to change our state. So when in doubt, you can always take a slow, deep breath or let out a long sigh. I didn't talk much about that, but there's research on something called physiological sighing. So just that can be very relieving and sort of reduce stress, and also has physiological effects on our lungs and reopening different. Well, yeah. And so those are sort of breathing practices that you can do on your own. The actual style of breathwork intervention that I mentioned usually are delivered by trained facilitators. There's not a ton of trained facilitators, let alone in Gainesville, but hopefully with more research, it's something that can be more widely accessible. And then there are professional treatments or services that you could seek out. And that includes things like manual therapies, such as massage or chiropractic care. Acupuncture has been shown to be helpful for pain and well-being. And then there are the practices that integrate movement with the breath or breathing, including yoga, tai chi, qigong, things like that. And there are often classes you could drop in for these, but also there are people on YouTube who can lead you through different sorts of practices if that's something you were interested in. I want to highlight this isn't medical advice, so consult your doctor before trying anything and just make sure that it'd be safe. But also do know that you're empowered to play an active role in your sort of health and well-being, and that there's different things that you can try to see what works best for you. With that, I'll just put back up the website. If you're interested in learning more about complementary and integrative interventions, nccih.nih.gov has a lot of information on the topic. They have an email listserv that you can sign up for if you want updates on this type of research. And then with that, I'd just like to thank my funders as well as my mentors. I can go back to this screen. There we go. And thank you everyone who made this possible, and thank you everyone here for your time and attention.
Thank you very much. That was very insightful and helpful. I participated in a biofeedback research program for breathing and control of blood pressure, not just pulse, as you showed, but blood pressure. And I found it quite effective. Not that I practice it regularly. But given the relationship between emotional stress and pain, I would wonder about using psychotherapy, which personally I have found very effective, not necessarily for pain, but for just making my life better.
Sure.
That was coming out of an abusive relationship. So, but I didn't see that listed. I mean, acupuncture, Tai Chi, except. So what about psychotherapy?
Yeah, that can definitely fall within this realm of integrative approaches, and certainly cognitive behavioral therapy is a type of psychotherapy, which is actually sometimes considered the gold standard or one of the most recommended approaches for chronic pain, along with many other things. Because you're right, there is this sort of emotional connection to pain in a lot of different ways, and it can make pain worse, and it can also get worse with pain. And just to quickly touch on your biofeedback and blood pressure point, there is good research that biofeedback helps a number of different things. But one of the challenges with these sort of integrative approaches is the ability to maintain the practice, because there can be like a dose response relationship of it might help for some time and then you stop and then some of the benefits might stop. But it's I'm glad to hear that it was also helpful for you too.
Okay. I once was a cognitive behavioral therapist before I retired, and I work with anxiety disorders mostly and some patients with chronic pain. And I usually taught breath work to them very early on in the therapy. And then you kind of can go from there and see how it benefits people. And there are also a couple other techniques that I was using which had to do with chronic pain. One was to ask the person to direct their breath to the part where the pain is. And that is often helpful.
Yeah.
And also another way is to relax your whole body and then take your relaxed hand and put it where it hurts and transfer the relaxed feeling to the pain.
Yeah.
So the question I have about all of this is, my experience is that most people kind of do a trial and error of try this, try that, try this. And is there some integrative way to determine for each individual what would be the best combinations to start with?
Good question. And I think your point's very valid about the attention before that. But that's part of this push for precision medicine. Like, we're trying to identify who might be most likely to respond to certain treatments. And it's very challenging. You need a lot of data. You need a lot of information. But ultimately, I think one of the best things might be gathering enough data where it could be considered an evidence-based medicine. And when a person comes to that crossroads to choose a variety of different treatments to try, if one speaks to them more than other, they're going to be more motivated to try it. They're going to be more likely to engage in it and actually get something out of it. So I think that's probably self-directed of for now, at least, until we have much more information of if a person is motivated to do it, then they might be able to sustain it and get more benefit.
This isn't a question, it's just a comment. Breathing exercises have been talked about a lot recently for helping you to go to sleep.
Yep.
Or to overcome chronic pain, which may keep you from going to sleep. And the numbers, different programs have different numbers, but inhale for so many seconds, hold it for so many, and then release the breath.
Yeah.
And I have found that to be extremely sucessful.
Really?
So I highly recommend it.
Yeah. Well, I appreciate hearing that. And that's the thing. It is variable. Like I had a participant call me today who did a group session last week, and she just said, I couldn't tell you the last time I slept this well for a week. And that had a big impact on her pain. And she just said it's a totally different life waking up more refreshed than not, and her attitude on going through things. So I appreciate that comment.
Opiates obviously reduce pain. Opiates reduce pain and also have a major complication with respiratory suppression. Is that the same mechanism that you're talking about in terms of breathing and pain? And the other thing is, could you do them together?
Yeah.
Could you look at complementarity?
That's a good question, and I'm trying to recall because there is some research that has looked into the mechanisms and whether more mindfulness, but it also includes a control condition, which is basically slow breathing, and they do influence opioid receptors in the brain differently, whether you're mindful versus not mindful and breathing slowly. So I think there's definitely could be a potential role, mechanistic role through breathing. But I also think there's got to be psychological mechanisms as well as, I mean, we did a pilot study in just a couple participants, and there are widespread brain changes when a person engages in more of an intensive style of breath work in terms of increased alpha rhythm and just sort of interconnected across different parts of the brain and more intensely than what's sometimes seen in just meditation trials. And so again, to me, it kind of goes back to the interconnected nature of the respiratory system for survival and our need. Like if you can take that system over by breathing consciously, it can touch other parts of our physiology in different ways. And so I don't really have a great answer for you, but I think that's certainly a plausible mechanism that is starting to get some research.
You mentioned at one point that the part of the purpose, or at least the important consequence of controlling breathing, is to get the heart rate variability increased. And so my question is, are we talking about the heart rate variability that is where you increase your heart rate on respiration and decrease it on expiration? Is that the kind of variability we're referring to?
So in the literature, heart rate variability is about the length of time between peak heart rates. And so the way I understand it is when there's more variability from beat to beat, that's a greater indication of parasympathetic nervous system activity. And so the idea is when it's less sort of standard beat, 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 there's less resilience in the system is how it's sometimes talked about. So I don't know if I have a good answer. I'm less, as a psychologist, less oriented to understanding the sort of physiology of heart rate variability. But that's kind of my initial understanding.
So has anyone combined looking at heart rate variability along with the breathing effects to see, is it the breathing per se, or is it the heart rate variability? That's
the way it's kind of done is that they modify breathing by changing how long a person breathes to then try to influence heart rate variability. And so if you were to breathe quicker, like just in and out rapidly, your heart rate variability would likely go down. But if it's long and regular, sort of that's the coherent breathing where it's equal counts of inhale and exhale, that's when they tend to see increases in heart rate variability. And so the biofeedback is trying to literally show a person their real-time heart rate variability to modify their inhale and exhale lengths to try to maximize it, if that makes sense. Okay. Oh. Yeah. Okay.
So first of all, I just want to thank you, and I agree with everything you said in your research. In 2004, I was diagnosed with fibromyalgia, arthritis, and I was also going through menopause, but that's beside the point. But at the University of Missouri, Laura Shop, who you may or may not know, was teaching a class on mindfulness-based meditation, stress reduction meditation.
MBSR.
I think. John Kabat-Zinn had started it, changed my life. And ever since then, I have meditated. I take tramadol, but all of it together really works.
while I was at the University of Missouri, I was head of the media relations office. We would have jumped on this research to promote it nationally. And so I just want to encourage you, when you have findings,
Mhm.
please contact Steve Orlando.
Okay.
He's my counterpart at the University of Florida.
Okay.
And they will do press releases on this so you can get it out
Mhm.
nationally, because this will go far and wide. So thank you.
Yeah, well, thank you for sharing that. It's always helpful to hear, or like encouraging to hear people's experiences too. And
Yeah, you know, he's moving to Ohio, so he'll have to find it there.
got 2 months left.
I had never heard of sleep apnea until I had it.
Uh-huh.
Sleep apnea. Could you talk a little bit about that? Because I have to sleep with a sleep machine and
Yeah.
I'm not happy with
They're
it.
uncomfortable,
no.
I'm sure.
But
Yeah, so sleep apnea,
It could have caused, it did, I think, cause some heart problems in me.
I was gonna, yeah. So sleep apnea is a form of sleep disordered breathing. It tends like while you're sleeping, you stop breathing for certain amounts of time. And that can be a very stressful experience to the body. It's like you're out of breath and you kind of have this gasping. And so that could release stress hormones and can cause non-restful sleep because you can't get into as much deep sleep or as much REM sleep. And so because of that, it can have these widespread influences on health and well-being, including affecting the heart. But also there's some research showing how it can affect pain. Again, I mean, part of it is inflammation. We clear out a lot of our inflammation during sleep. But there's also, I'm in the College of Dentistry and sleep disordered breathing. When that happens, sometimes the way to open the airway is our jaw tends to clench because it creates a wider airway. And so it could lead to headaches and jaw tension going forward. And I don't know if that's your experience, but that's one way that sort of sleep disordered breathing or sleep apnea itself can contribute to stress, hypersensitivity in the nervous system, which can lead to widespread pain too. But there's lots of different ways that it could influence pain and health and well-being. In terms of treatments, I've wondered whether certain types of breath work could help with it. I've had at least a couple people in the more intensive style of breath work who have disclosed they have sleep apnea, found it kind of challenging because it almost reminded them of the feeling of apnea. And so it's definitely an open sort of area of we don't, like, it would be great to have a breathing technique rather than a CPAP machine, but we're not there yet, I don't think. But I do wonder whether maybe the restrictive breathing device could help in other ways too. There's two different forms, not to go on too long, two different forms of sleep apnea. One is central sleep apnea, which is more from the brain, but then there's obstructive sleep apnea, which is more from our anatomy and like the tongue falling back when it relaxes and then it blocks the airway. So it's complicated, but I'm wishing you the best. Yeah.
Yeah, thank you, Steve. This was fascinating. And good luck to you and your
Thank you.
studies. Wonderful. Next week, the speaker will be on pain and aging, or aging and pain. Does pain ages you, or does aging makes you hurt more? So do come. Make an
Mm-hmm.
yeah. No, yeah, maybe that's true. I think she's young.
Right.
Yes. Pardon me?
Right.